Hello, everyone. I'm Patrice Brown, Zero's Vice President of Patient Programs and Advocacy. I'm here with Mike Crosby to talk about Zero, Veterans Prostate Cancer Awareness, and COVID-19. Mike, thanks for joining us on Giving Tuesday.
Thanks, Patrice. It's a pleasure to be with you and all the Zero champions today, and all of you that are chiming in or tuning in. I wanted we wanted to take the time to talk about our joint partnership between Veterans Prostate Cancer Awareness and Zero, the End of Prostate Cancer. It's important to note that a number of reasons why we're doing this is that some of the studies that have been released recently from the VA and from Prostate Cancer Foundation came out showing a large number of veterans currently in the system dealing with prostate cancer. The total number right now that was determined last November is 489,000 veterans active with prostate cancer in the VA. And of those, over 16,000 men are dealing with the metastatic form of the disease. In addition, we're also seeing a rise in the annual numbers up to about 14,000 new cases diagnosed every year. Now, we don't know why that's happening. We believe it's a lot of exposure or maybe more aggressive testing that might be happening. We're trying to increase the number of tests that are going on and encourage men to learn about the disease and not be afraid to go and get the testing and do it early, which if you're detected early, as the statistics are showing that if you're low to intermediate stage upon detection, you have about a 99% chance of curing the disease. However, if you wait, that detection or that cure rate goes down to almost 30%. So it behooves everybody to actually get their testing and pay attention to their health.
Yeah, thanks, Mike. And, this is why we really wanted to partner so that we could really pool our resources and have a greater impact in what's happening with prostate cancer and vets. Can you take us through kind of what this partnership means from a vet's perspective and what we can look forward to?
Sure. Veterans Prostate Cancer Awareness, which I started a few years ago, was growing, and we were raising more awareness across the country. However, it just seemed like a natural fit to merge the veterans focus into Zero because of Zero's long history and very successful outreach programs across the country. By integrating into and having access to the resources offered by Zero, it immediately gives veterans more of a place for outreach and really to help us raise awareness. And what we've accomplished this year already is we now have permission to actually advertise the Run Walk series within the different VAs and the cities that we're going to be holding the Run Walks in. And I know that it's COVID-19, we're all in lockdown. This isn't going to last forever. We're going to solve the COVID-19 issue. Unfortunately, prostate cancer will still be present and we'll still be dealing with it when we're through this. So as the Run Walks start to come back, we're going to also be advertising those and encouraging the staff and the physicians at the VAs to come in and network with all of us at these different events. And I think it's going to be a big boost to veterans to actually help spread the word and show that they have immediate access to the various resources like Zero 360, the mentor programs, and the summit that happens every year within Zero, and all of our educational resources. So I think it's just a natural merger that needs to happen, and I'm very proud to say that it's been going very smoothly, and then everybody is the access to the different resources are just incredible.
So, Mike, you were just talking about Zero 360 and Zero Connect, some of the programs that we have at Zero, and why it's important that we decided to come together to support vets. I mean, we're really here today because Zero needs to raise $25,000 on this Giving Tuesday now to support those programs and to support our COVID-19 fund and allow us to help men and their families with these free programs that we have. Can you talk to us a bit about the financial and emotional support that vets need now in the face of COVID-19?
Sure. And $25,000, we should, let's raise that today. Let's challenge everybody out there and all the big corporations that have vets working for them. I mean, everybody's everybody should be able to pitch in, $1 for every vet that works for you, and help out. I think that would be a great challenge out there. Some of these big corporations, that veterans actually are going to impact their workforce, and the loss of those veterans due to the disease having, even either to go through treatment or, unfortunately, to the loss of that individual can make a big impact in a company. So give a buck, send in $1 for every veteran employee. It'd be a good challenge to all the defense industry guys. In the VA right now, we're seeing a lot of impact from the 2018 Mission Act that was signed. It was a replacement for the Choice Program. And one of the intentions was is to bolster up the Community Care Network, which is the program that's the VA has put in place to support veterans outside of the VA. So if you need care and it's not available to you inside the VA, there is a mechanism now, and it's been properly funded. I would applaud the administration and Congress for providing $100 billion to this program. That's spread over a 6-year period of time, and you have to, as a provider, as a physician provider, or a urology group, for example, or a radiology group, you have to sign up and you have to contract with one of two organizations, either Optum Healthcare, which is a portion of United Healthcare, or TriWest, and they're pretty much split on the both coasts. You sign up for those and you're under contract to provide your care at a Medicare reimbursement rate. And what that does is it provides veterans with access to care outside the VA for this disease, any disease, but we'll talk about prostate cancer specifically. And there's a number of reasons why you want to do that, because the VA, being a government organization, just doesn't have all of the access to all of the current technology that might be available, or the current resources that the general public has. And so this has provided a resource or a pathway to allow veterans to do that. It also, when you talk about the COVID-19 thing, it gives you more options than having to go to a veterans hospital or a VA hospital. You can go to your community clinics and that sort of thing to get your treatments, or to see physicians if necessary. So I know that's a growing concern with prostate cancer patients, and keeping up with your treatments, whether you're either going through radiation or you need infusions for chemo, or just check up with your PSA test. It's you've got to go someplace to get these things done, and you're not going to get them done stuck in your house in lockdown. So you need to, there are mechanisms. We need to go out and just take care. But it is a concern. It's a growing concern.
Yeah, it's interesting. You talk about the fact that folks need to come out of their homes at some point, right? So you're a vet, you're a prostate cancer survivor, but yet you're living within this age of COVID-19. How has it impacted your life?
Significantly. We went 4 weeks without seeing grandchildren and that sort of thing. So it makes a big impact on even the family dynamics. And they're 5 miles away from me, and our contact's been like this, FaceTime and on the phone. So we've and it's now you have this whole new dynamic of wearing masks and keeping up with hand sanitizer, and do you go out, do you not go out? And it's unfortunate. I have a great support system around me. So I have daughters and wife and everybody else that put me sort of in a special category, and they go and get the food and they do the stuff, and we all kind of have got a system down. But I've got to go get PSA tests coming up. I've got to had a recurrence, and so now I'm dealing with having to go get a test in a couple of days. And it's like, okay, which the anxiety goes up, because is this real? Is this not real? What precautions do you take? Are you going to get it? Do you go to the hospital? Where do we go? And so how do you pick a place that reduces your risk of exposure to other people? And we just didn't used to think about that. And it is a new normal, I guess. And so yeah, it's a concern. I'm not going to let it stop me. Living our lives, we have to at some point get back to a new normal. But we need to consider these things. And I don't feel that I'm too immune compromised. I think I've had just my radiation treatments, and I'm lucky that I'm not you hear conflicting stories. I think it's something that we as Zero have been putting out as to what compromises or what can categorizes you as immune compromised. I read something the other day that ADT doesn't necessarily make your immune system compromised. However, you add that, not too many people are just on ADT anymore. There's always some other combination drug. And so those guys are being affected by their immune system is being affected, and they do have to be careful of that. So, and I also heard that, I'm trying to check into it to verify, but the VA has, for certain cases, and I think we would qualify as a specialty case, they'll come to your home to draw your blood. So, or they'll send someone out to do the blood draw at your house. So you don't have to come and expose yourself to the whole hospital. And I'm checking in to confirm that. If that is the case, we'll put out a notice about that.
Yeah, it's interesting. There's so many things that are changing right now, right? And so one of the key things we always say is talk with your healthcare professional to learn about your unique situation. One really is unique in their combination of treatments and what will work for them. So I'm curious now, as a vet and a member of this community, what's your message to someone that's thinking about why they should donate to Zero?
Well, it's even more important now that we're not able to be so present in the public, that like a lot of industries and a lot of other companies, we've had to shift our focus into this social media realm and to this new advertising or this new communications realm to get to educate men and to educate providers and to recruit people. And so that takes time, it takes money. There's people that, the 0360 program that we offer, that's free to patients. It's free to caregivers. It's free to, physicians. I've had physicians calling in asking questions about, are the patients okay? Or how do we get in touch with them? What's the better way to communicate? Or what are you guys doing for speeches and information and those sorts of things? And so we need donations. We still need the resources, and even probably more so because of the fact that we're kind of distance. We have this now distance between us and the face-to-face public awareness type of things that we were doing. And so we're having to restructure our communications plan and utilize more online resources, try to get a bigger brush. So do we advertise? Do we, how do we get marketing information out? How do we can stay in constant touch with these, physicians and patients at the same time? So yeah, it's important that we keep all of the mechanisms going. They're all still there. They're all still in place. So we still need those donations. We're still going to have the working group, which we'll talk about at a later date, but we're going to be, involving people, and maybe it's a different way of doing it, but we can all still be present. We can all still communicate, but we do need those resources to just to pay the bills, to keep all of the resources, keep all of our education routines in place and all of our outreach kind of capabilities going. And that's, so yeah, I do encourage everybody. And like I said, every defense contractor I'm trying to contact now, asking every HR department to donate $1 on Tuesday to every veteran, in your corporation. So in some of those companies, like I'll call out like the Lockheed Martins, the Northrop Grumman's, the Boeings, the Raytheons. These companies have 20, 30,000 veterans working for them. Primarily, they're male workers. So I know the numbers at Lockheed Martin, we've been in discussions. They have 25,000 veterans that work for the company. 90% of those are male veterans. And of that, 80% are over the age of 40. So guess what? There's about 20,000 men right there that are facing this issue, that need to be educated and need to understand what their risk is and what their risk categories are and what their options are. And they need to be tested. They need to be on top of this and paying attention to what's going on.
Yeah, Mike, I think you've said it. We're in this new normal, but what doesn't change is the fact that we need to keep educating. Prostate cancer is still here and folks need to know about it. And so that's why we need folks to donate so that we can keep this going. I really want to thank you for your time today. For everyone watching, let's not forget that when you donate today, your gift is doubled And we can't be more grateful for that because it's so generous, but it really gets us to where we need to go. Giving Tuesday now is important, and we need your help and support. So Mike, thank you for your time today, and thank you for all the work that you're doing and for your service to our country.
Oh, you're welcome, Patrice, and thanks for everybody, and please give on this Giving Tuesday. I mean, we just need everybody just needs to reach deep and throw $1 on the table, and let's make this a real successful Giving Tuesday.